Hi there, question for you. Did you know that there's a correlation between weakness or instability of your hips and your risk of falling or your risk of injury? Makes sense, right? And it's something that we see a lot here in physical therapy. Hello, my name's Dr. Cara Hoffer. I'm a physical therapist here at Physical One, here for another Tip Tuesday. Today we're talking about ways that you can increase the strength, stabilization in your hips. I'm going to be giving you 3 tips that we can do to accomplish this. Number 1 is quite simple. Oftentimes, when we're experiencing pain or other issues in our hip joints, we tend to stand with our weight shifted. Say it's my left hip that's painful, we stand away from that side. And this can often be a mistake. We want to try, as much as tolerable, to keep our weight shifted between both legs evenly. This goes for when you're standing, when you're walking, when you're doing something like squatting. You want to have both your feet pointed forward and make sure that you're strong and stable between both sides. If this is a challenge for you, you can start by practicing standing and just shifting your weight from side to side and getting used to having weight through that leg. Number 2, we're going to be talking about balance exercises. We have a saying here at Physical One, and the saying is that if you have 30 seconds to put your coffee in the microwave, then you have 30 seconds to work on balancing. So we're going to be practicing a balance exercise, very simple. We're going to be doing a one-leg stance. So again, you want to have something to hold on to. It's best to do at your kitchen counter, your kitchen sink, somewhere stable, and we're going to practice just balancing on one leg, like this. When you're balancing, again, make sure that your toes are pointed straight ahead. You want to try to engage your gluteals, keep your core strong, and then try to hold your balance there. You can also practice with your eyes closed. This definitely increases the challenge. The next tip I'm going to be giving you, tip 3, is for strengthening of the hip. So you can do this exercise either without weight, or if you have an ankle weight or a TheraBand, we can use those to make the exercise a little bit more challenging. What we're going to do is we're going to be moving our hip in 3 different directions. And it's actually good practice, if you can, to do this on both sides. So we're going to be moving our hips in this way. You're going to stand, again, holding onto your counter, your sink, something nice and stable. We're going to be moving this leg forward, like this, to the side, like this, and backwards, like this. I want to give a few tips for this exercise. The leg that you're standing on, it's important to try to engage those gluteal muscles. Keep that standing leg nice and strong. Keep your body nice and tall, your core is engaged, and keep the movement through the hip joint this way. Trying not to move your upper body or your trunk as you're doing the exercise. One more time, forward, side, and back. Please follow us on social media. You can like us on Facebook, subscribe to our YouTube channel, and follow us on Instagram for more helpful tips.